Good morning. Today I have the pleasure of visiting the office of Brentwood Pediatrics and speaking with Dr. Juan Espinoza. Dr. Espinoza, it's very apparent in visiting your office that as a pediatric healthcare provider in the Brentwood community, you're very well respected and have a very strong connection in the community. Can you give us some background about the history of your practice and what has made you a cornerstone in the community?
Yes, thank you. Our practice started in this community in the late 1980s with two pediatricians who were solo practitioners. At the time, it was the only practice in the immediate area who accepted straight Medicaid patients. And obviously, that meant that a lot of the patients that they saw and that the practice had, or the majority of those patients, were working poor. And a lot of immigrant families, and so when I joined the practice in 2002, after I completed my training, all these patients with straight Medicaid started being switched to Medicaid HMOs, and that sort of began the new way of practicing at the time. The patients were the same. But the way that we practiced was different. With the HMOs came a smaller reimbursement, and that's when we started taking a little more advantage of the quality incentive programs, and in order to make up for the shortfall in reimbursement. And the practice continued to grow. We had more people join us, and eventually we outgrew the space that we were in, so we moved into this space about 10 years ago. And this is where we are. Right now we have 7 providers, and it's we have about 10 to 12,000 active charts, and we've seen a lot of these kids grow up, and a lot of them bring their kids here, and it's really wonderful. So.
Wonderful. So we had talked a little bit about the importance of community providers in their own communities, and how that helps deliver healthcare in a different way than a large system. So can you talk a little bit about that?
Yeah, sure. I strongly believe that community. I went to high school here, and I know this community firsthand. A lot of our employees, in fact, most of our employees are local. A lot of our employees are actually our ex-patients, and we all understand this community. So it's a lot easier to provide good care when you understand who you're providing it to and what their needs are. I think that's been sort of the secret of our practice, and why we've been able to compete, as you say. It's really never been about focusing on competing or doing it better than somebody else. It's just doing it better for the community that we're serving. Always trying to figure out what it is that they need, and working that into our workflows, into our workarounds, and making sure that we're covering those bases as well. At the end of the day, it's just a matter of providing good care. And if you're good at what you do, you just stay in business in general. But I think with medicine especially, I think that if people feel comfortable with the care that you provide and the environment that you provide for them, I think that they're able to better care for themselves, and it's easier for them to comply with visits, with screenings and vaccines and things like that, because they trust you, because they see that you're part of their community, and that you're responding to their needs. I think that's the secret of why independent practices are so much better at providing care for smaller communities, because there's no top-down approach. There's no square peg, round hole.
Flexibility. Yep, the flexibility about the flexibility that you have because you are an independent, and really addressing every patient's needs, and not every patient being cookie cutter
Right.
and having to deliver the same kind of care. So I think that that's critical in addressing that. And you said something earlier about listening.
Right.
How much the part of your practice is just listening
Right.
and making people feel comfortable, in caring for a child, a new child. So that is very interesting.
Yeah, I think, as a physician, I think listening is actually, part of the privilege, right? I think, people don't go into medicine, or at least none of the people that I trained with went into medicine just to make money or just to tell people what to do. I think that being in people's lives and having the privilege of being in people's lives is the reward of being a physician. And when you're being distracted by, checking boxes and doing all the other things that have to be done, you don't get to do the work. You just get to do the job. And I think that we want to practice medicine the way we want to practice it. And I think our patients see that. And we design the workflows to satisfy those two needs, the needs of the patient and our interest in doing good medicine and doing medicine the way it should be done in our view. I still don't think that medicine is an industry. I think that medicine is a profession, and yes, I understand that things have to be paid for and the beans have to be counted and all that, but at the end of the day, these people aren't clients, they're patients. And we're not just technicians, we're providers. We have to listen to people. We have to figure out what it is that they need when they come in, and then figure out how to give it to them before they leave.
So I see you looking at children, so I think I know what your passion is and what rewards you.
Yeah.
Being a pediatrician, but can you just share with us what is the most rewarding part of your job and your day?
Yeah, I think I really think in terms of children, I think that children are really. I know this is very cliche and all that, but it's really the reason everybody does everything. It's everything we do as adults is to make sure that the next generation is better than we are and better off than we are. And for me, being part of that effort overall in society, I think is very rewarding. Personally, I get I get a lot of healing from seeing children. Just being part of their lives, families, being part of their families, being part of their health. Sometimes they're difficult moments, and being able to help them with that. But for me, it's watching them grow up, being part of their families, being part of their lives, and being able to contribute. And the other part of it is to be part of a community that where people flourish. I like to see where we employ a lot of people from the community. Our employees eventually go to school, they better themselves, and then I think that's another rewarding part too. I think it's that we're not just delivering medicine to the community, but we're part of it. We're an actual part of the rest of the community, along with the businesses and the churches and everybody else. So I think that's
Absolutely. Thank you for all that you do, Dr. Espinoza, and thank you for taking the time out of your busy schedule to spend some time with us today.
Thank you.